Good afternoon. My name is James Martinez. I am the admissions counselor for the University of Houston College of Pharmacy, and we are starting our faculty research project so that we can present information to our incoming students on what research opportunities are available and what are some of the benefits to incoming P1 students. Joining me today is Dr. McConnell, and he's going to share with us some of his insights in his research. So Dr. McConnell, if you would, can you provide a description of your research focus?
Yes, and thank you, James. First of all, let me introduce myself. My name is Dr. Bradley McConnell, and I'm an associate professor of pharmacology in the Department of Pharmacological and Pharmaceutical Sciences in the College of Pharmacy at the University of Houston. And before I describe my research program, I first want to say my expertise in research is cardiac genetics and cardiac physiology and cardiac pharmacology. So with that approach of cardiac interests, my research interests are mainly focused on three different projects. One, characterizing what's called A kinase anchoring proteins, or ACAPs. And what the ACAPs are signasomes, or scaffolding proteins, which bind enzymes and fine-tune the cell signaling mechanisms within cells. In particular, my interest is cardiovascular cells, or the cardiac myocyte. And one particular ACAP that I study is called ACAP12, or Graven. And that binds this scaffolding protein of enzymes to the beta-2 adrenergic receptor and fine-tunes the signaling. So that's one project. The second project I do is actually dealing with the beta-2 adrenergic receptor and looking at its biased signaling. So how does one receptor activate two or more different cell signaling systems? And this is this biased nature. So how does one drug bind to a cell receptor, activate one pathway versus another? And we're investigating that work as well. And thirdly, what's actually really exciting right now is looking how to guide reprogramming of immature, primitive, or what's rather a cardiac progenitor cell, and how to guide that and reprogram those cells from a primitive state to a mature cardiac cell, in particular, looking at cardiac conduction cells. And these are cells which I'm using for cardiac repair. And there are two different types of cardiac cells that we're looking at. These are conducting cells. One is a pacemaker-like cell, and we're trying to go towards creating a biological pacemaker, and therefore replace the artificial current electrical pacemaker devices that currently are used to regulate rhythm in the heart. And secondly is looking at creating Purkinje-like cells. And this is by restoring the electrical conduction, or then the function of the heart following, say, a myocardial infarction or a heart attack, to transmit the electrical current across the cell by replacing the conductivity of the heart through injection of these Purkinje cells that we have formed in the research setting. So those are the three components of what I do in my lab. And of course, these are all very, very exciting work. And I'll move on from different questions from there as well.
Okay, so if you would, Dr. McConnell, for students who are interested in research, does the student need to have the same focus with your research area to work with you, or can they be in an exploratory phase? We get a lot of students who they're interested in research, but they're not exactly sure what area they want to go down.
Exactly, and that's a very good question. And so how do I encourage research among my students? And I encourage my research team in my laboratory to study these questions in cardiac function, cardiac research of both genetics, physiology, and pharmacology by integrating these research projects of cell signaling of the beta receptors, signalings, and creating the differentiation of these cardiac cells into creating biological pacemakers and restoring cardiac function. By integrating this research with my teaching, as well as service to the community. And my service can be through looking at grant study sections, by manuscript reviews, editorial board reviews, and serving on various different committees, both on the local and regional, as well as the national and international communities, and participating in programs that across the international communities and disseminating research. And with this mission, I'm fulfilling my passion for mentoring students, not only primarily graduate PhD students in my lab, but also other students, and such as undergraduate students, but most importantly, the pharmacy professional PharmD students in addition to the graduate students in my laboratory. And I truly try to continually strive to achieve the highest academic and ethical standards by leading by an example, by being a positive role model, all the while contributing towards the mission, values, and goals of the department, the college, the university, and the national and international research communities. By coupling these goals to advance basic science research, I'm continually passionate about researching significant and innovative questions that affect cardiac disease, therefore for cardiac repair. And I'm committed to mentoring all students, gain research access, develop scientific expertise, and prepare them for academic independence through investigating the prevailing paradigms in science, specifically through heart research. With these, I have been a recipient of the University of Houston Undergraduate Research Mentor Award, the University of Houston Group Teaching Excellence Award, as well as the College of Pharmacy Faculty Awards for Excellence in Service and Excellence in Research. And I use these skills to help mentor graduate students, pharmacy students, and undergraduate students in the research setting.
That's amazing. That is awesome. Congratulations. And it's really good to see kind of what opportunities faculty are able to present with their expertise, and then working with students. Like you said, I really like the component of the mentorship because our students, they're coming in, you know, it's about 50-50 for students who have a bachelor's degree who come into our program. So when you look at that, there's a lot of really young students who are still finding their way through school, through young adulthood. And so having mentors like that is such a critical component. In working with you, what are some skills or interests that are necessary for pharmacy students?
So for a student to learn some skills, PharmD students can learn by conducting research in a lab to actually be engaged in any laboratory that matter, not just my lab, but how do drugs work? What goes into discovering new drugs and using these drugs, which are the same drugs they're learning about in their PharmD classes. And by studying the drug action on living cells, students will learn about the mechanisms of actions of these drugs. And also by studying drug action on living cells, students can develop the research and skills in research and discovery. But probably most importantly, by working in the research setting, students learn about problem solving, finding solutions to their questions through critical thinking, and applying their knowledge to address these questions they're trying to solve in the lab.
Thank you. And then also, so we talked a little bit about what skills that they need or that they might, what in addition to that, you know, what skills will they gain and be able to take from their P1 through 3 or P1 through 4 experience and apply that into their career? Can you talk a little bit more about that?
Yeah, and I think what I would want to say though is how do PharmD students, how do they learn about research opportunities to develop these skills in doing research? And how does this change their focus in terms of career choices? I mentioned before, in addition to mentoring graduate PhD students, I'm also mentoring professional PharmD students in basic science research, also through academic performance and their career development. And also participate in different programs of mentored research by participating in the research mentoring program to PharmD students by collaborating with the College of Pharmacy's chapter in the Student College of Clinical Pharmacy, or SCCP. I also have done independent studies. So this is to teach students about research in the laboratory, to learn about basic science research, and they also receive course credit while working in my laboratory. And beyond these two formal programs, I also have informal discussions with students in my office, and also allow them to shadow members of my laboratory, just get an idea about how research is done in the laboratory. In such, I'm also currently mentoring 3 students. There's Surab Ghana, Neethu Matthew, Hiba Al-Shakli. And these students are gaining some experience. As of right now, we're dealing with the COVID-19 pandemic. So put on a little bit of a hold, but they all did work last year, and I hope that once the lab is more fully open and people come back to the lab, they also 3 of them can come back into the lab as well. But with this experience, I help guide the professional PharmD students who are pursuing the professional degree in pharmacy to help decide in their personal career development to whether work into a clinical pharmacy practice, a hospital pharmacy, government agencies, pharmaceutical industries, or move towards what I do in terms of academic institutions, but also providing them opportunities in the PharmD, PhD dual degree programs as well. And with all these different experiences, try to mentor students to gain that knowledge to help drive their career choices and make the best fit for their careers.
That is great. And if you would, as we kind of close it out, is there anything that you want to add as far as what you view from your perspective as a faculty and researcher that you'd like to share with potential incoming students?
Yeah, exactly. And so how do PharmD students benefit, and what can they experience they can get by being a student researcher? And in general, students who are interested in conducting research during the PharmD program really need to have that enthusiasm to be involved in something that's clinically relevant, translational, but basic science research in nature. Students also need to be inquisitive in nature, to ask those fundamental questions, and also have the curiosity of how do cell systems actually work. Now, students who want to work in my lab for particular, as I do cardiovascular research, they need a couple of these attributes of such as enthusiasm, being inquisitive and being curious, to the interest of cardiovascular science, particularly understanding heart function as well as for cardiac repair mechanisms. Also, students who do work in my lab, they need to also have the shared interest and support of the mission of the American Heart Association, which the mission of the American Heart Association is to be a relentless force for a world of longer, healthier lives. So with this enthusiasm, this curiosity and inquisitive nature of PharmD students, they can create a lot of experiences and shape their own personal skills to what they want to do for their future research career and pharmacy endeavors.